Well, welcome, Jan. I'm so excited that you're here as one of the conscious visionary leaders on the edge of evolution. And I'd love to introduce you. This is Jan Anderson, and she is the director in Watson Caring Science Institute of the Caritas Coach Program. And she has been an educator in nursing. And one of the things that I want to share with you about Jan right off the bat, she has the biggest heart, the most love, and has so much kindness. And she has been a tremendous leader for introducing people into Watson Caring Science. So it's with tremendous happiness and joy I welcome you to be one of the speakers of the Telesummit.
Thank you, Mary. That's very high praise. Part of what I love to do is share my passion for caring science. And your ability to be able to do that lies in our humility, actually.
True.
So it's hard, I love it. It's hard to share it in a way that's meaningful and makes sense to people, because sometimes Jean's work is so simply complex that it can be hard to understand. But I feel so fortunate that I can share her work with so many like-minded people, because that's what's sorely needed today during this pandemic. This is what's keeping us human. And you see it in the nurses are leading the way, actually, which is so amazingly wonderful. I feel very proud to be part of this group of people making such a difference in the world. So thank you for inviting me. I really love being here with you.
Great. Well, I really am so honored and so appreciative of the work that you're doing in the world by bringing people into understanding the intimacy of Dr. Jean Watson's work. And I'd like to hear from you based on your involvement in nursing as your career and the work that you're doing with caring science. Where do you think we can go? And how can we co-create this future? And one of the things I've really, in listening to the speakers, is each person has their own perspective. And I really am hoping that the listeners will be inspired by what's coming forth to be able to honor the voices that are emerging with them. So tell me how you see we can create the future of nursing.
Well, obviously, I think that caring science is key. The message I think that it gives all of us is a message of hope. The Caritas Coach Program obviously is my passion, and I've been so fortunate to be able to work with such amazing people in it as students and as faculty, because it helps us to transcend the everyday moments into moments of caring and healing, which is what the work is all about, really. We have the opportunity as Caritas coaches to actually apply caring science in real and practical ways that make a difference. I just attended a Monday morning meditation with Stanford, and our Caritas coaches have organized this since the pandemic as a way to begin the week, centered, educating about caring science. And that's just one example of a very practical and real way to apply caring science in our work. I know we talked about for years the idea of when a patient comes into the hospital, they ask, is there a Caritas coach or is there a Caritas nurse here? Because those are the ones they want taking care of them. And not just in the hospital, but in the community, wherever they are. Caritas coaching isn't just for nurses, it's for anyone. We've had respiratory therapists, physical therapists, chaplains, social workers, physicians. And so this caring science by Jean transcends actually position, role, job description, whatever. It's something that's present that brings us the humanity and the dignity that we all want and deserve, I think. So it's a message of hope, even with all this fear. There's her her theory reminds us that we need to be in the moment. We need to be present, just as we did when we centered before we started here. We need to see what's going on, feel and understand what's going on, and then do something about it. Make some kind of morally informed choice of what's best, what's most biogenic in what we're doing, life-giving and life-receiving. It's not a standard step-by-step process. It's a circular process that begins in us. So I don't know if that answers your question, Mary.
That's beautiful. And I think what I hear you saying, which is really important as we move into the future, I hear the starting point is within ourselves.
Yes, absolutely.
And there's a message of hope. And tell me more about, as we move into ourselves and as we make the changes in our own person, in our own humanness, we start the journey from within. Tell me more about that.
Yes, you're so right, Mary. And what happens in Caring Science, the Caring Science curriculum, and in the coach program is that we take this inner journey. It all begins with us. We aren't concerned with what others are doing. We can't change them. All we can do is focus on what is in us to find our own inner wisdom. And
Right.
what that means is that we become more self-aware, more conscious. The title of your series is so, apt really, because we develop a consciousness about ourselves and a self-awareness about where we're coming from, what our past has been, what our experience has been through the lens of Caring Science. And we find ways to make that more meaningful.
Right.
Most of us really want to feel as if we're heard, seen, and understood at some level. So the Caritas coach, to be able to do that, must begin with themselves. If they don't understand where they came from and how they feel and why they act in a certain way, they certainly can't understand where somebody else is feeling, because they're stuck in their own self. And Caring Science is all about being transpersonal, letting go of self and being with another in an open and healing way.
I love that. What I hear you saying is the consciousness and self-aware. And as we know ourselves better, we can become clearly connected. Tell me more about the transpersonal, when you talk about that.
Thanks, Mary. Yeah, the transpersonal is a way of connecting with another from their frame of reference.
Right.
And that applies to anything we're doing with another. And Caring Science is all about relationship with ourselves and relationship with others in ways that we are able to be present and available and open, which means non-judgmental, accepting them as a human being just as we are, and not making a judgment or evaluation about what they're doing, saying, or however they're acting. We want to be able to see them for who they are. And then if we're in a coach role, what that means is that we're teaching by being. In other words, it's not a CCEP is not it's a theory class, which is interesting, because when you think of a theory class, it seems very, learn the theory, the history of the person and all the terms, and memorize those. But this theory class teaches you how to live the theory, which is so much different.
So much different. The Caritas Coach Education Program, CCEP, is really about how to be this caring essence and phenomenon.
Beautiful, Mary. That's exactly.
I love that.
Yeah.
And that's the evolution of consciousness that we're striving for. And that's the evolution of the future. And what I hear you saying is, we start with ourselves, we become self-aware. Yes. We are given into the relationship with the other, and that is our focus.
Absolutely.
And then our consciousness evolves. As we are a coach, we're coaching them. So tell me more about that, because that to me is the cutting edge.
Yes.
That to me is the edge that we're at right now. As we are creating our own consciousness, we are evolving. So therefore, how do we move into this next evolution of ourselves?
Yes, that's so true. We are on the cutting edge, and we've been on the cutting edge for a while, but I think the pandemics has pushed us over the edge, actually.
I think so.
Because we've been sent to our room and told to think about it. You know, what's most important in your life? Why is that important? How have you been? How have you treated the environment? How are you treating yourself? And those are the questions we're being forced to re-examine. Is it really important to go by, or is it more important to be? And as Jean says, and many others have said, the next evolution of the human being is in consciousness. So this is what we're doing. And as a Caritas coach, that means that we live with more intention and awareness, as you've said. And let's see if I can give you an example. Let's say you are taking care of a person wherever they are, community, in your home, in a hospital, and you go in and do your checklist of chores and tasks to do. You feed them, you change their bed, you take their vital signs, and that's all important. But you've left out the humanity of what it is we do and why. And part of being a coach is not only approaching someone to preserve their dignity and their humanity, but it's about educating them. And that's the coaching part. So the coaching part empowers others. We see the people that we empower as being able to recognize more options, being creative, being whole in the first place. They're not defined by their diagnosis or their job or their role in life. They're defined by who they are. And so we get to know, we explore and discover who they are. And that's part of the joy, really, of being connected to another. So
well, what I hear you saying is there's not problems to be solved. What there is there's a human being that has a sense of their own self-awareness. Mm-hmm. And when we become self-aware of ourselves, I love this idea of it's the next evolution of consciousness, because that is what this is about. We are evolving consciousness, and that is the future. And as we move into that, it's as if the unknowns, one of the things about Jean's work is I love what she says about there's a mystery unfolding every single moment. And as a coach, you hold the sacred space for that person to be who they truly are.
Yes, absolutely. I just love that, because everyone is whole. They have that ability and capability of being able to care for themselves. And sometimes they just need a little help. And as a guide, as a coach, we are that light for them. We are the person who can show them the way. And we do that by taking care of ourselves and by honoring ourselves and by recognizing when we need to transform, repattern, as Jean says. Sometimes how we respond is not helpful. It's not respectful, possibly, or it's not mindful, not thoughtful. We're just caught up in our own day and what we have to do, and we haven't thought about how the other person is feeling about what we're doing. So it's a lot. But the empowerment and intention and consciousness are really part of this journey, and we gain that by practicing self-care, those micro practices of breathing, centering, visualizing, healing touch. All the caring healing modalities are so important. And so we do that in CCEP too. It's always surprising that people don't have the time to take a moment to breathe and center. But that's the foundation of everything that a coach does.
Everything. What's so beautiful is that our breath is always with us.
Yes.
And that, to me, consciousness is becoming aware that our breath is there as our tremendous resource. You know, you think about it.
Yeah.
It's always with you.
It is always with you, and you have conscious control of it.
Mm-hmm.
So, you know, people don't think that. They just think, oh, I don't even have to think about breathing. I'm breathing. And that is true. But we also have control of it. And with the pandemic and wearing a mask and not being able to be within 6 feet of each other, we understand more than ever how connected we are and that we're all breathing the same air. And
Yes.
that, you know, we're breathing somebody else's breath.
Yes,
And
exactly.
so Jean calls it the breath of life. Right now, we're afraid that it's not the breath of life, but it is.
It
And
is.
I think carrying science is the entry point into that perspective.
That's beautiful. So, and tell me, if you could make a wish that you could magically create in the future, what would it be?
Oh boy, that's a hard one. You know, I always go back. My favorite song as a kid was, what was the name of it? All We Need Is Love, or Love.
Love is all we need.
Something like that. But it wasn't the Beatles song. It was a different one. It was earlier than the Beatles. But anyway, I just wish everyone could feel loved, cared for, heard, and seen. Caring science begins and always is always underlined. With the ethic of belonging, that we
Right.
all belong, that we're all important, that everyone has a voice, that everyone wants to be part of, and it's actually needed for health,
Yeah.
mental, emotional, and social and physical health. So that's the other thing we're being forced to recognize. You know, where do we belong and why? And are these helpful communities? Are they communitas? Are they surrounded by love and care? And how do we get more of that? Because we need it. We see we need it and we
Yes.
want it. So how do we create those communities where we all feel we belong and are heard and seen and loved and accepted for who we are? So always easier said than done, but that's the wish, I think.
That's beautiful,
Yeah.
because I think if we go into the future knowing that that's our intention,
Mhm.
what I hear you saying is we develop our own consciousness, our own self-awareness, and that we're in relationship with the other, and that our intention is to feel seen and be loved to others. Like, that is what they want. People want to be seen,
Yeah.
loved, and heard. And as caring is the portal, you know, caring is the ethic of belonging.
Mm-hmm.
And I think it is my hope that, you know, with tremendous appreciation, that your words, Jan, those words that you speak are they're the, like, they echo. I hope they echo through all of eternity, because I think that's, in everyone I've spoken to, that's the simplest and most beautiful and truly caritas.
Mm-hmm.
You know, that's the beauty of this work that we're doing.
Yes, and when you're surrounded with people who feel the same way,
Mm-hmm.
the effect is magnified. It radiates further than we can even possibly imagine. And so we make a difference just with those thoughts and those intentions. And to love and accept each other is so important. And I think that's what we try to promote in the Caritas Coach program as well. So
Right.
I feel honored to be part of it. It's my passion, as you know.
I know it. So
Yeah.
there are going to be listeners who don't know about it. So just share with them how they can find out about the Caritas Coach program. And one of the things I also wanted to ask you is if you can find the link to that song so I can put it as a link after your talk so everybody can hear that song.
I will. I'll find it. And I'll
I
find
like
it.
that.
I didn't even think of it till you asked me that, but I used to listen to it in the car with my parents when we'd travel. And I just thought it was the most beautiful song. So I will find it and I'll give you the
Good.
title too.
That'll be great. And I'll
Yeah.
get a link for it.
Yeah, so the Caritas Coach Education Program, we shorten it to CCEP, is a 6-month online program. We just went to totally online because of the pandemic and the possibility that we can reach more people worldwide. And we have close to 600 graduates globally. So we have graduates in Italy, Africa, Sweden, Canada, US. I know I'm missing some, but
Japan,
Japan.
everywhere.
Thank you.
Yeah.
Yeah, so we have wonderful graduates, and Mary is one of the faculty. She's fabulous. And we have graduates who are physicians, social workers, nurses, everybody, business people. You don't have to be a healthcare professional. You can be an educator, anybody. What we do as a Caritas coach transcends any position, any location. And I think the online version is going to be really great because, as we know, and just as Mary's doing now, our thoughts and actions transcend time, space, and location. So we're radiating this, this feeling, these ideas from ourselves out. So that's why we start with ourselves. So every fall and spring, we start a class and we end a class. And the application is on the Watson Caring Science Institute website. And it helps to have experience in caring science at some level. So if you don't have it, there are some free online programs also on the WCSI website, MOOCs, Caring Science Mindful Practice, and Watson's Caring in the Digital World, which is very timely at this time. And they're excellent courses. I've taught in both of them and taken them both, so I can vouch for them. And our graduates are working everywhere. They're working in communities, businesses, acute care hospitals, walk-in clinics, surgery, any specialty you can name, that's where they are. And they're making it a real difference. We've had CEOs, CNOs, chief nursing officers, staff nurses, anyone you can imagine. We've had them, and I think it's a life-changing course. I know it was for me. I got to be in the first class, and although we learned a lot, the program's come a long way since it began.
Yes.
So,
well, I want to appreciate you for your leadership in this and being able to create this moment is a call to nurses worldwide as we call you back home to yourselves.
Yes.
Because that's what the Caritas Coach program really begins. It's like, how do we call ourselves back home, starting with our own heart, starting with our own consciousness, and giving us a way and a foundation to be able to speak clearly in a group where we know we belong.
Yes.
And be able to bring the love that we're destined to bring into the world.
Yeah. And you do that so well, Mary. I'm just so grateful to be part of this.
I am so grateful. Thank you so much, Jan. And you know what? I just want to share with everyone who's listening that as we do a call out to nurses in the world, I want you to meet Jan. She is an incredible human being who is so true, so authentic, and so real. And as we mirror ourselves to the possibilities within ourselves, we do have these visionary leaders who are conscious, who are on the edge of something brand new happening, and we're not alone doing this.
Yes, absolutely. You are not alone. We love you. And I think in some way I see so many people that aren't being included, but who are also leaders. I think formal or informally, you're all leaders in this transformation of consciousness that we're all being part of at this moment. So thank you, Mary.
Thank you. This was a great. All right, take care. We'll be in touch.
All right.
Bye-bye.
Love you.
Thank you. I love you.